These are 5 knee-saving exercises every adult over the age of 60 must do. Skip them now, and pain will catch you later. Exercise number 1. Straight leg raises. Lie flat on your back on a comfortable mat or firm bed. Bend one knee so that your foot rests flat on the floor, while the other leg stays extended straight in front of you. Tighten the thigh muscle of your straight leg, almost as if you're pulling your kneecap upward, then slowly raise the leg until it's level with the bent knee. Hold for 2 to 3 seconds at the top, feeling the front of your thigh working, then lower the leg back down with full control. Perform 10 to 12 repetitions on each side, aiming for 2 to 3 sets in total. This classic exercise is called the straight leg raise, and it's one of the safest ways to build knee strength without putting extra pressure on the joint itself. For older adults dealing with arthritis, stiffness, or chronic knee pain, it's a gentle but effective way to strengthen the quadriceps, the powerful muscles on the front of your thigh. Strong quads act like a shield for your knee, keeping the kneecap stable and reducing grinding or discomfort during everyday activities like walking, rising from a chair, or climbing stairs. To get the most benefit, keep your toes pointing straight up and your leg as straight as possible during the lift. If you feel tension in your lower back, slip your hands under your hips for support. With practice, you'll notice more security in your knees during long walks or when stepping off a curb. But strength isn't everything. The next exercise develops balance, the true key to preventing sudden injuries. Exercise number 2. Seated knee extension. Sit tall on a sturdy chair with both feet planted firmly on the ground. Keep your back supported but upright, holding the sides of the chair for stability. Slowly straighten one leg out in front of you, lifting your foot until your knee is fully extended. Hold that position for 3 to 5 seconds, feeling the muscles in the front of your thigh tighten. Then, lower your leg back down with complete control. Repeat this movement 10 to 15 times on each leg, aiming for 2 to 3 sets. This simple move directly targets your quadriceps, the large muscles on the front of your thighs. These are your knees' built-in shock absorbers. As you get older, they naturally weaken, and when that happens, every step sends more force directly into the knee joint. That's when stiffness, pain, and even balance problems begin to creep in. By keeping your quadriceps strong, you're giving your knees a natural protective shield, making everyday activities like standing, walking, or climbing stairs far less stressful and far more comfortable. The key here is control. Avoid snapping or locking the knee at the top. Think of it like moving through water, smooth, steady, and deliberate. Over time, this controlled strengthening will ease the strain you feel when getting up from lower chairs or when standing for longer periods. But while this exercise builds strength, it doesn't yet secure your balance. The next move does exactly that, giving your knees the stability they desperately need to stay safe. Exercise number 3. Heel slides. Lie flat on your back with your legs stretched out comfortably. Bend one knee slowly, sliding your heel toward your buttocks while keeping the opposite leg fully extended on the ground. Pause for just a second at the top, feeling the gentle bend in your knee, and then carefully slide the foot back down until the leg is straight again. Aim for 10 to 12 repetitions per side, completing 2 to 3 rounds at your own pace. This simple yet powerful movement is known as the heel slide, and it works wonders for restoring knee mobility. Over time, the knees tend to stiffen from lack of movement, arthritis, or simply years of wear and tear. That stiffness makes bending, kneeling, or even getting in and out of chairs more difficult. By practicing heel slides, you gently oil the hinge, improving joint lubrication, boosting circulation, and breaking through that rusty, locked-up feeling many older adults experience. If lying on the floor feels uncomfortable, don't worry. You can perform this on a firm bed with just as much benefit. And if sliding your heel feels tricky, place a small towel under your foot and use it as a smooth track to guide the motion. Remember, this isn't about speed or force. Think of it like slowly drawing the leg back and forth, teaching the joint how to bend comfortably again. Stay consistent with heel slides, and you'll notice bending to tie your shoes, stepping into a car, or lowering yourself into a chair becomes easier. But mobility alone isn't enough. The next move awakens a hidden stabilizer muscle that keeps your knees tracking safely with every step. Exercise number 4, standing knee marches. Stand tall beside a sturdy chair or countertop, keeping one hand lightly resting for balance if needed. Slowly lift one knee up toward your chest as if you were marching in place. Hold the lifted position for 2 full seconds, then lower it back down with control. Switch to the other leg and repeat the same motion. Aim for 12 to 15 repetitions per side, completing 2 to 3 rounds in total. Knee marches are deceptively simple, yet highly effective. This movement does far more than just lift your legs. It strengthens the hip flexors, thighs, and core muscles, all of which play a vital role in stabilizing your knees with every step you take. For many older adults, weak hip flexors are the hidden culprit behind shuffling instead of walking confidently. That shortened stride doesn't just look unsteady. It actually increases your risk of tripping and falling. To maximize the benefits, pay attention to your posture. Keep your shoulders back, your chest lifted, and your spine tall. Each march should feel slow and deliberate, not rushed. If you struggle with balance, keep both hands on the support until you build more stability. Then try using only one hand, and eventually none at all. When practiced consistently, knee marches improve stride length, reduce shuffling, and restore the ability to step forward with confidence. You'll notice everyday walking feels lighter and smoother. Strength and stability on the front side of your body aren't enough. The final exercise targets the most overlooked area for older adults, the back of the legs. Exercise number 5, hamstring curls. Stand behind a sturdy chair, holding the backrest for support. Slowly bend one knee, bringing your heel toward your buttocks as far as comfortable. Hold for 2 to 3 seconds, then lower with control. Perform 10 to 12 reps per side for 2 to 3 sets. The hamstrings, located at the back of your thighs, are essential for knee stability. When they weaken, your knees take on the strain alone, leading to injury. By strengthening them, you create balance between the front and back of your legs, giving your knees the support they need to function without pain. Keep your thighs close together while curling, and avoid swinging your leg. If bending too far feels uncomfortable, go only halfway. Consistency matters more than depth. Over weeks, your strength will grow and movement will become easier. When the hamstrings are strong, you not only protect your knees, but also improve your ability to climb stairs, rise from low seats, and walk longer without fatigue.